So first, I would like to ask for your permission for this interview to use it for educational purpose and on the internet.
Absolutely.
Thank you. Now, first tell me, what were your symptoms before the surgery?
Before surgery, I had very severe pain in my back, and then also shooting pain all the way down to my big toe on my left side.
Okay.
But it was constant pain, and it was severe.
1 to 10, how bad was the pain?
It was about 8.
8. And, for how long had you had that pain before the surgery?
A long time.
Big years?
Yes.
Okay. Now, after we failed the conservative therapy, we did a 1-level fusion for you. And I'm just going to swing to pictures here. And we are just about 1 year after the surgery. As a matter of fact, you told me we are
It's
exactly
a year
1
today, exactly.
And here we see that the bone is growing in the interbody area, we call it. So the fusion is actually advanced, but it can get stronger with time. And in the back as well, we see that the bone is making connection on the right side, but not on the left side. In some other regards, you are not one of my spectacular results. Tell me, you had that leg pain. Is that leg pain now there?
There is no leg pain now.
And but it didn't go away right after the surgery, because usually it does. So tell me,
it took about 6 weeks, 4 to 6 weeks to get rid of that pain.
And this is the purpose of this interview, to show that the leg pain, even though very often goes right after the surgery, you don't have to panic if it doesn't go right away after the surgery.
The pain was less right after surgery. However, there was still significant pain for that 4 to 6 week period. Therapy after the fact helped a great deal with that as well.
And as well, I think what helps therapy is to teach us what to do and how to do that.
Well, I think the movements that we try to remember that we used to be able to do versus the restrictions that really are needed makes a big difference. And the therapy did help with that aspect of it.
Your back pain as well took few months to go away.
It did.
But you told me, it wasn't there all the time and it was different. Can you elaborate on that?
It depends on the movements that I was doing. If you're doing bending or twisting, the pain typically would increase. And if you followed the directions that you were given exactly, things went very well. But as human beings, I don't think we always follow those instructions.
No, you just told me you have been building your house. Is that right?
I was remodeling.
Okay.
And that was on the list of things to do, but it wasn't on your list.
So, now, overall, how are you now?
I'm very good. I'm very pleased.
Okay, so your pain that you had is gone and you're back to your usual life?
I'm back to my usual life. If I do too much, there's still muscle pain, but that's simply because you haven't taken and utilized some of these things.
Yeah,
so,
but you're telling me that,
my everyday life is good.
Good. And then, but I'm going to show you as well what other problems that are lurking. You and we are not 18 years old anymore, unfortunately. And, our spine
I only think I am.
Yeah, but, we have, I just was looking at this area that shows our osteophytes or bone spurs. So there are some other problem. You see that where we did the surgery, you see the osteophytes are separated. And that means the pressure of the nerve is gone there. But look at here, we did not do the surgery and osteophytes are sitting on each other. So your spine is as old as you are, and we just have to live with that. And but for all practical purpose, I think that you and we are done. And I hope, in that sense, I never see you in the hospital again. Okay.
I hope not too.
Thank you for the interview.
You